This video has been produced to familiarize you with the Uterine Fibroid Embolization procedure, UFE. UFE is a safe, effective treatment for fibroids that has been performed for nearly 20 years. It is one of several treatments that may be used to treat fibroids in the uterus. Uterine fibroids are non-cancerous growths that develop from normal uterine muscle cells. There are 4 types of fibroids that develop in or just outside of the uterus. Submucosal fibroids grow into the uterine cavity. Intramural fibroids grow within the wall of the uterus, and subserosal fibroids develop on the outside of the uterus. Pedunculated uterine fibroids occur when a fibroid tumor grows on a stalk, resulting in pedunculated submucosal or subserosal fibroids. All fibroids require a supply of blood to survive and grow. UFE takes advantage of this fact to target the fibroids. Uterine fibroid embolization is a minimally invasive procedure. UFE does not remove the uterus or the ovaries. A small incision is made in the leg to gain access to the femoral artery. A long flexible tube called a catheter is then inserted into the femoral artery. It is guided up the femoral artery and into the artery that supplies blood to the uterus, called the uterine artery. The catheter is then guided to smaller arteries that supply blood to the fibroids. Uterine fibroid embolization delivers tiny microspheres to the artery that supplies the fibroids, cutting off the blood flow, causing the fibroids to shrink. The tiny microspheres are injected through the catheter and travel through the blood vessel. Since the microspheres are more than 60 times larger than red blood cells, they plug the tiny vessels that red blood cells travel through to feed the fibroid. The procedure is repeated in the uterine artery on the other side to make sure that all blood supply to the fibroids has been cut off. All fibroids are treated simultaneously. Once the blood supply to the fibroids has been blocked, the fibroids begin to shrink. There is no scar tissue and minimal blood loss with UFE. Recurrence of the fibroids with uterine fibroid embolization is rare. Most women are able to return to light activity within a few days of the UFE treatment and are usually back to work and normal activity, on average, within 11 days.